Hello, I'm Dr. Brant Gibson, and I'm so excited to take a moment today to discuss with you the 3 secrets every neuropathy patient must know now. So often you are given the diagnosis of peripheral neuropathy. So often you are told there is nothing that you can do for it, and so often you are sent out wondering even what the words peripheral neuropathy even means. So I want to give you 3 very, very important secrets today. And at the end, if you feel like this is information that is important to you, I'm going to give you an opportunity to take part in a program that will allow you to learn about, receive diagnostic information, and even manage your peripheral neuropathy from your own home, even from your very own computer, with the help of your local physicians, your local doctors, the doctors you're used to working with. In saying that, first off, I need to give you those 3 secrets. And that is an important piece of the information that we're going to do today. So let me switch my screen so that we can actually show you what we're talking about, and then we will go from there. So, to help you understand here, we got these 3 secrets of peripheral neuropathy. I run a medical practice, a podiatry practice in Utah, and in that practice, we are actually working on options to help you get the treatment that you deserve, the treatment that you need. So, who am I? I've been a podiatrist since 2001. I'm a specialist in peripheral neuropathy for almost 20 years. I've been working on this. I guess I should give you a little bit of background. When I was in school, one of my goals of becoming a podiatrist was finding a way to help keep people active, give people the options and the information they needed to really be able to function and enjoy their families. I'm the father of 11 children with a grandchild on the way in a little less than a month, and I want to give everybody that opportunity to be available for their children, their grandchildren, and to be able to do the things that they love. And what I found is one of the biggest obstacles that I run into on a daily basis is with those individuals with peripheral neuropathy. To give you a little bit of background, I usually use a fake patient, a patient that is a combination of a lot of the patients that I see, and I call her Sarah. Sarah went to a visit with her physician and was told that she had peripheral neuropathy. And that was all she was told. And she was told that there was really nothing that they could do for it. And so she left wondering what was going on. And her big 3 questions that she asked is it true I have a condition that can't be treated? And number 2, when did my nerves stop working? And 3, was it something I caused by my lifestyle, by something that I personally did? So you're sitting there with peripheral neuropathy. You've been given the diagnosis, and you've been given usually not a whole lot of options as far as what you can do to treat it. And so you may be the same as Sarah. You may be sitting there going, wait, what? This is something that I get to live with for the rest of my life? This is something that I have to just function with? And for the rest of my life, I will have the numbness, tingling, pain, and disability that comes with peripheral neuropathy, and there's nothing you can do for it? Well, I want to give you some options. It is very, very important to me that I give you a way to be able to function with your family, to be able to function and reach your dreams, even though you have the new diagnosis of peripheral neuropathy. So we're going to discuss 3 things. 1, peripheral neuropathy is not a life sentence. Number 2, peripheral neuropathy can be treated. And number 3, you can live an extraordinary life with peripheral neuropathy. You can live your dreams. You can enjoy your family. You can get everything that you want out of life, even though you have the diagnosis of peripheral neuropathy. So let me give you a little bit of background of peripheral neuropathy. Peripheral neuropathy has been found to be upwards of 21 million Americans that are suffering with this disease. 21 million. And that's only those that have been diagnosed. It has always been present, but it's also been very poorly understood and poorly studied. A lot of times, physicians that have been around a long time still don't have any information, any real information they can give you as a patient or you as a caregiver about peripheral neuropathy and how you can go about it. Peripheral neuropathy can occur, of course, at any age, but it's been found to be almost 10% of Medicare patients because it's more common in older patients. So almost 10% of all Medicare patients will have peripheral neuropathy and will be limited by that diagnosis. The other interesting thing about peripheral neuropathy is it's commonly misdiagnosed and may even just be considered a side effect or a complication of something else like diabetes, for example. So let me give you this first statement here. Although peripheral neuropathy can't be cured, you aren't stuck with it. You aren't stuck with the discomfort. You aren't stuck with the pain. You aren't stuck with the disability for your life. Now, that's the first thing I want you to understand. I'm not promising you a cure for your peripheral neuropathy. To this point, I have not found one. I wish I had a cure. I wish I could wave a magic wand and say, okay, you're now no longer have peripheral neuropathy. The purpose here is that it can be treated, it can be managed, and ultimately you can live a normal life even with peripheral neuropathy because of things that we now know you can do. So, can I take away your discomfort and your pain and your disability? Yes. Can I cure peripheral neuropathy? No. But that is not required to give you back your life. So second thing, peripheral neuropathy can be treated. More importantly, it can be managed. So as opposed to just say, okay, we're going to give you treatments. We're going to give you a narcotic pain medication. We're going to give you a nerve-modifying medication like Lyric or gabapentin or Neurontin or Cymbalta or one of these other medications they give you in hopes that you have less of the symptoms. I'm telling you, you can treat your peripheral neuropathy. You can manage your peripheral neuropathy often without medications and get back to normal life often without medications. That's huge. If you really think about what that means that there are things that you can do. Now, just because I've said that there are treatments available does not mean that your doctor will have those treatments and will give you those options. Even a lot of neurologists don't treat peripheral neuropathy. They give you the diagnosis and say, there's not many things we can do, and they send you on your way. So you often need to find a specialist in peripheral neuropathy so that they can give you the options that you deserve so you can actually get control of your symptoms, control of your neuropathy, and get back to your life. So what kind of treatments are available? I really break them down into 4 different groups. 1, nerve re-education. 2, nerve reset. 3, nerve repair. And 4, nerve repression. So the idea is peripheral neuropathy is not a failure, a complete failure of the nerve to work. In most cases, the nerves still are working. If they weren't working, of course, you wouldn't have any symptoms. But they are working. And so what you have to do is determine what is the real problem, what's really going on with these nerves. Is it a problem where the nerves are sending the signal, but they're sending them wrong? Re-education can actually help you get those nerves so they're sending the signal correctly. Or is it a problem where the nerve needs to be reset? A lot of times with computers, for example, if your computer's not working, you call a support person, the first thing they're going to do a lot of times is have you reboot your computer. What if you could reset your nerves? Reboot your nerves and have them start to work a little bit better. Nerve repair. This is the most valuable, and this is the one with the most research that's coming out nowadays, is there are things that you can actually do to repair your nerve. Now, if you were to go in and cut a nerve, like a spinal injury or something like that, or you do a surgery, have a surgery and this nerve is cut, that still is very poorly understood about getting that type of repair. In fact, to this point, they haven't found really good results yet But we are seeing repair of these nerves that are malfunctioning, that aren't working like they're supposed to. We are even seeing regrowth of small fiber nerves, the little nerves in the legs and the feet, for example, where through certain treatments like a vitamin regimen, for example, you can see the nerves growing back over a 6-month period. And then nerve repression. This is a very important piece that allows you, even if you don't have complete resolution of your symptoms, to still live a normal life. And so we will talk a little bit more about that. So re-educate. The most common way that we found to re-educate the nerves is a machine called CalMare. The treatments usually are 5 to 10 treatments. It's best if it's done over a short period of time. So for example, in our office, we will do 5 treatments, take the weekend off, do 5 additional treatments. By doing this, you are actually re-educating the nerves. Now, the disadvantage of this treatment is it's not just you don't just do it and then say, okay, we're done. It's going to work forever. It only works for a period of time. In fact, the first treatment, if you do 1 treatment, usually you're only going to get 20 minutes to 2 hours of relief, and then everything comes back. And so you have to do those 10 treatments to give yourself basically a 48-hour or longer symptom-free period. In most cases, once you get to 48 hours, you're going to get months of relief. The best that they've seen in the studies is over a year of complete absence of symptoms from the CalMare treatment. This is really, really good, for example, of taking away nerve pain or nerve discomfort. And it works quite well through a scrambler therapy is what they call it, which is a sequence of having the nerves learn how to send the signals correctly to the brain so it can improve the brain interpretation and allow it to really get the information. So instead of you stepping down the ground and feeling pain, it says, I'm touching the ground, or sheets are touching my feet, or whatever, so that the symptoms are not a problem. Reset. The best thing we found so far for resetting nerves is a neurogenics type treatment. Neurogenics is a specialized electrical stimulation device. In your home, you probably heard of, say, a TENS unit, which could be utilized in a similar fashion, but is not quite as effective. And what this does is actually helps the weaker signals. So if you have a signal that's just not strong enough, this reset causes the signals to improve, and you're getting better signals to the brain, better signals to the muscles, better signals overall that allows you to get better results as far as the symptoms of neuropathy. The disadvantage of this treatment, it works best with a combination of a nerve block because it allows us to increase the signal, give you more treatment, higher electrical stimulation, for example, without causing discomfort. And so we usually use those two together, but what it does over a period of 20 to 24 treatments is it resets the nerve, causes the nerve sensation to return to normal. This has been very, very effective, for example, on one patient that we have. To protect her identity because of the HIPAA compliance, for example, I'm not going to use her name, but what she did is she was actually suffering with this discomfort for more than 10 years. She had pain and numbness and was unable to feel the gas pedal and so forth, and it was really, really a problem. Through undergoing the neurogenics treatment, we were able to completely reset her nerves, and in a short period of time, she had complete resolution and she could feel normal. She felt the gas pedal when she drove in here. She had none of the night pains and discomforts because of the neurogenics treatment. It is a very valuable treatment. It is a form of reset of the nerve, and it works quite well. We are finding similar results much slower using certain types of TENS units and getting a specialized treatment modality that you could actually do at home. Third one is repair. Like I said, this is the most valuable and the most studied process, and it includes multiple different ways to actually cause the nerves to recover and to improve. The most common treatments we found is the MLS laser treatment, orthomolecular treatment, nutritional treatment, and exercise treatment. MLS laser is a form of laser treatment, it's a hot laser that switches between two frequencies to allow repair of the nerve as well as decrease of pain and decrease of swelling. The advantage of this over an hour period of treatment is you start to notice a significant improvement of the way the nerves are functioning, and it's additive. So each treatment you receive, the nerves get better. So over a period of time, you're getting a significant improvement of the way the nerves are functioning. Orthomolecular treatment. The most common treatment that people are getting nowadays, if they're being treated, is vitamins. Most of the time they do a shotgun approach. They give you vitamins, say these vitamins are supposed to work. Orthomolecular treatment actually takes very careful evaluation of your vitamin levels, determine whether you have a vitamin deficiency or a vitamin dependency. Deficiency being it's too low. Dependency being even though you're in the normal recommended daily allowance amount, it's not high enough for your body, whether that's because of a protein deficiency or a enzyme that's not formed like it's supposed to. Whatever the reason, your nerves require an additional amount of a certain nutrient, and so we have to get to the orthomolecular level of treatment, which is higher than the recommended daily allowance of a vitamin, for example. Number 3 is nutritional treatments. Yes, vitamins or orthomolecular will fall into the nutritional treatments in a way, but I utilize this to talk more about how much of the fluids are you getting into your body, what nutrients, what special nutrients, how are you supposed to be eating, what are some things that you can actually do to modify the health of your body, which ultimately modifies the health of your nerves and allows them to recover. And exercise has been very valuable at causing improvement of the peripheral neuropathy in all of our patients that we've seen. The oldest and most poorly utilized treatment is repression. So if you could say, okay, I can do something to block out the nerves so that they're not causing an issue, just suppressing the pain. People do this on a regular basis. Very, very talented individuals can do this through meditation, relaxation, and mind-body processes, where they can literally take control. And it's something that we are actually starting to utilize to allow people to have one more tool to get control of their peripheral neuropathy. So if you could get really good at meditation, you would need less of some of the other treatments to really function at a normal level. So you know that you have the peripheral neuropathy, and it's not a life sentence, it's something that you can actually manage. You know that there's treatments available and there's things that you can do either in doctor's offices or at home, and the goal being, of course, as many as possible of things that you can actually find and say, I can talk with my doctor and get these treatments through my own personal methods and still get the improvement and control that I desire. And so the third secret that I want to tell you is that you can live an extraordinary life even with peripheral neuropathy. Let me tell you about another patient. This patient actually came into our office on high amounts of morphine, was unable to walk, couldn't go see his grandkids' baseball games because he couldn't make it from the car to the field. And so he stayed home most of the time. He didn't go anywhere. Through undergoing careful evaluation and treatment, he was able to return to the baseball games. And he was able to reduce significantly the amount of morphine that he was taking. And it was making a huge difference in his life because he started to enjoy some of the things he used to enjoy. Can you imagine saying, after years of not being able to go see your grandkid play a baseball game, to go sit on the sideline and say, I'm now in the bleachers watching something that I've always loved to do, even though I have peripheral neuropathy. Or maybe you have a dog and you like to go walk your dog, but because of your peripheral neuropathy, you can't do it because it interferes with your life. We have a patient that was her goal, to get back to walking her dog. And by undergoing these careful treatments and these careful evaluations, she was able to get back to walking her dog and could take her dog on longer walks even without having to suffer for days after that process. And it was huge. Let's even go a little bit further. What if you had a motor neuropathy and where the motor muscles are weak and you can't walk for any amount of time without it becoming a big interference in your life? We have one patient where she is relatively young, still has young children, but she can't take them to the park. She can't take them for a walk. She can't even go to the store without paying for it for long periods of time afterwards. So through this process of some of these treatments, some of these options that we're doing, we're taking away her regular pain. She's making it through the day without being exhausted and having to rest. And she's not getting the weakness that has been a huge problem in her life. And although her nerves are not normal, she's got more of her life back. Although she still has some weakness and she will, in certain activities, it'll still get weak over time. There are things that she was not able to do for years that she's now doing with her children, with her husband, in her home. That's the goal. To live a life that you desire in your home. Ideally, we want to get the symptoms reduced to such an extent that they don't interfere with your life at all. But think of even taking steps forward where they're not a problem, they're not something that you have to deal with. Think of what that could mean for you if you really, really, truly understood these three secrets. If you really, really understood that peripheral neuropathy, although you have it, doesn't have to keep you from doing things you want to do. Number two, peripheral neuropathy can be treated. It can be managed. The secret to this management is you. You have to have the information, you have to have the tools, you have to have the options to really get control of your peripheral neuropathy. And the third is, once you get control, then that allows you to do things you thought you would never do again. Maybe you're going to go on a hike. Maybe you're going on a vacation that you didn't think you could do. Maybe it's just a matter of being able to get up every morning and participate in the normal activities of normal life. Whatever that is, you should be able to enjoy your life and ultimately have what I like to call an extraordinary life. Doing what you want to do, being with who you want to be with, and not having the disability, limitations, or even discomfort that comes with peripheral neuropathy. So if you will indulge me a little bit, I'm going to give you some additional information about how you can do this and try to make it simple and easy and make it so that you can, if you desire, take another step to getting control of your life, getting control of your neuropathy, and getting back to those things that you want to be doing. So over the last 20 years, I've been working with peripheral neuropathy, and I came up with a system that allows me to diagnose the problem, find the causes, and then ultimately get people back to functioning through the treatment methods that we have. So we're identifying and treating all the causes of peripheral neuropathy, not just diabetes. We're evaluating and treating peripheral neuropathy to improve the possible problems that are happening and hopefully to resolve any nerve abnormalities or nerve signal problems, not just the symptoms. So I'm not trying to just block the pain like gabapentin, Lyrica, or Neurontin would do, but instead improve the nerves so that they're not having pain. And then I want to help you get back to a lifestyle and know what that means. So through this process, we're taking our patients back to a more normal function, and then we're giving them tools they can use for the rest of their life to continue to maintain, monitor, and even modify peripheral neuropathy in their lives. So the Gibson method is quite valuable. How much would it be worth to you if you could say, I now know why I have peripheral neuropathy. I now know what I need to treat, and I know how to treat it. What if I said you don't need to travel to Utah? I'm located in American Fork, Utah. You don't need to travel to me, and you don't have to leave your current doctors and look for a specialist in your area necessarily to get the benefits of the Gibson method. How about if most of this treatment, most of this Gibson method process could be done from your own home, in front of your own computer, only going out to receive certain tests or to get certain options done. Would it be worth it to get your life back? How much would you be able to pay, or would you want to pay for that kind of a solution in your life? So, to make this possible, I created the Gibson Method 90-Day Boot Camp. It's an online course, an online training that goes over a 90-day period with daily information, daily processes that you're going to go through to get the information that you need to improve nerve health, to manage your peripheral neuropathy, so that you can live that extraordinary life without limitations. So, to help you understand how this works, the easiest and best way to do it was a four-legged stool. I like the four-legged stool analogy because if you take a four-legged stool and you break off one of the legs, that stool is no longer stable. If you break off two of the legs, it doesn't stand at all. And so you need all of these pieces to truly get control of your peripheral neuropathy. And so by doing the Gibson method, it gives you this process to walk through the four pillars or the four legs of managing your peripheral neuropathy. So pillar number one is understand peripheral neuropathy personally. It's very, very important that you understand what neuropathy is. You need to understand it. You need to understand how your neuropathy differs from other individuals. You also need to understand what you need to do to get that information about your personal peripheral neuropathy. For example, what if you could take a test and it would say how bad your peripheral neuropathy is? We have a neuropathy score, an ability to take a assessment and determine from the information that you're able to get where you fit on a scale from 0 to 100, with 0 being normal, 100 being the worst neuropathy you could have. Number two, manage the symptoms. Pillar two, manage the symptoms of peripheral neuropathy. So first you're to get the understanding of peripheral neuropathy and understand what your peripheral neuropathy is like. And then you're going to say, okay, let's get control of these symptoms. Let's manage these symptoms. And by managing the symptoms, you get a good portion of your life back because you're no longer having the pain, the discomfort, the disability that comes with peripheral neuropathy. You're able to function and do what you want to do. That's why a lot of people will end at that point, assuming they got any understanding of peripheral neuropathy in the first place. Most of the time, if they are getting treatment right now, all they're doing is managing the symptoms. Gabapentin is designed to manage the symptoms of peripheral neuropathy. Lyrica is designed to manage the symptoms of peripheral neuropathy. Even a lot of the vitamins that are being given to individuals are designed to manage the symptoms of peripheral neuropathy, not necessarily being utilized like they could be to control nerve damage, which is pillar number three. So if you had one leg or two legs in this four-legged stool, you would fail. With neuropathy, if you only get to the point where you're just managing your peripheral neuropathy, you're going to fail because neuropathy cannot be cured. And so you're continuing to cause damage to those nerves. So by controlling the nerve damage, the peripheral nerve damage in your body, you can slow down the progression of peripheral neuropathy. And ultimately, you can actually fix this problem. Control peripheral neuropathy nerve damage. So if you can control the nerve damage by diagnosing the causes, by treating those causes, and ultimately by understanding how those causes are going to affect the different nerves, you can actually create a process to say, okay, I want to get control of my life by using these lifetime tools, these important mechanisms to treat diabetic neuropathy, for example, or compression neuropathy, or whatever the cause of your nerve damage is. And by doing that, you get a more stable stool because you have now three legs. You understand what peripheral neuropathy is. You understand your peripheral neuropathy. You're managing your symptoms, so you're having a more normal life because you're not having the pain or discomfort or disability. And now you're stopping the damage so that you're not getting a return of those symptoms as quickly as if you continued to damage your nerves. And then you say, okay, now I want to live a normal life. Now that I know what's going on, now that I'm doing what I need to do, I want to thrive. Pillar number 3 is thrive with peripheral neuropathy. I want to live an extraordinary life. And so that's what we're doing at this point, is we're saying, okay, we want to get to the point where we're thriving and we're controlling our neuropathy so much that you can actually live your dreams, live what you want to, how you want to live the life that you're hoping for. So how does the 90-day boot camp make this happen? So the first 14 days, we work very, very hard at helping you understand your peripheral neuropathy. One of the things that we do is we give you the 5 truths of peripheral neuropathy in packet and video form to help you understand those key pieces of peripheral neuropathy that you need to get a better understanding, so that you have the words and the information necessary to be able to talk to your doctor, for example. We give you the beginner's guide to peripheral neuropathy. This is an ebook that is going to be available on Amazon in the near future, but in the meantime, we're making it available to our boot camp members for free as part of the 90-day boot camp. And with this ebook, you get the stepwise process that you need to understand, to truly understand your peripheral neuropathy. There's also informational packets and videos on neuropathy symptoms with a log to track your symptoms and allow you to say, okay, what are my symptoms? How do my symptoms compare to what they're teaching me about symptoms? So you can actually take a deeper dive into your peripheral neuropathy. And we have a master class on understanding what peripheral neuropathy is. This is a master class that's already available. People are already paying for this, are already paying money to get an additional understanding of their peripheral neuropathy, but with nothing additional that they can actually do to take the next steps to continue to manage it. We're putting this as part of this program, so you get the master class for free. There are also additional videos so you can understand exactly what the nervous system is: sensory neuropathy, autonomic neuropathy, motor neuropathy. And then like I said, we're introducing the neuropathy score, and we're explaining it to you so you can completely understand what it is, how it works, how you can improve the efficacy or the value of your neuropathy score by getting additional information. So you can truly say, where is my neuropathy compared to those around the world? We have an additional master class on nerve malfunction. One of the biggest misconceptions of peripheral neuropathy is that the nerves are not working. That's not true. They're malfunctioning, but they're still working. And so this master class teaches you all the ins and outs of how the nerves are malfunctioning, how that affects you, and how you can go about looking at it and treating it. The top questions every neuropathy patient should ask their doctor ebook. This is another ebook that will soon be available on Amazon, but is available to you here through this process, so that what we can do is we can actually take all these questions for neuropathy patients and give them to you in your hands. You can go to your doctor, you can ask these questions, and you can get the answers that you need to truly understand your peripheral neuropathy. All of these things together, if you had to buy them individually, are worth $997. And that's doing them at an inexpensive rate. They're worth $997, almost $1,000 just for those first 14 days. But there's more, because we've only done one pillar. So pillar number 2 is managing the symptoms of peripheral neuropathy. And this is a 16-day process, and we're doing similar type things. You get the secret steps to managing your peripheral neuropathy, another ebook that we're giving to you as part of this program that will be available to others through Amazon. The Gibson Method Masterclass. So you need to understand the Gibson Method, what it means, how we go through the diagnosis process, how we go through and determine what types of neuropathy you may have, how we go through and actually give you the best options for managing your symptoms and ultimately controlling the peripheral neuropathy damage that you will do in the future. We have an additional master class on pain. One of the biggest side effects, one of the biggest problems that you run into is pain with peripheral neuropathy. So we give you a whole course, a whole class on how to manage your peripheral neuropathy pain. How powerful, how valuable is that to you? If all I did was give you that class, it would be worth a great deal, because you could now find a way to manage your neuropathy pain in your own home, in your own life. We have an additional ebook, Managing Peripheral Neuropathy Keys to Success, which is carefully determined keys that we have put into place to say, okay, here's some things that you need to put in place in your life to allow you to truly manage the symptoms of peripheral neuropathy. We have instructional videos on the nerve re-education process, the nerve reset, the nerve repair, and the nerve repression, which includes information on how it works and why it works and when it's necessary and when it's most valuable. We have information on vitamins in neuropathy and when they should be utilized. Nutrition in neuropathy, like we said, taking it a little bit step further. We have a nutrition log that allows you to track how you're eating. You can say, okay, compared to what I'm being told I should do, what am I doing? And over a period of time, you could actually make modifications and get control of it, because you'll understand, okay, what am I doing for my nerves, and how can I improve that problem through tracking my nutrition. Then we have an additional ebook, Peripheral Neuropathy Secrets Every Neuropathy Patient Needs Now. So as opposed to just some of these steps to manage your peripheral neuropathy or the processes that you're going through, we're giving you the secrets that you should know, that every neuropathy patient needs to know, so that you can actually really get control and manage your peripheral neuropathy and understand it, for that matter. Again, this is a $997 value because of the ebooks that are in there, the master classes in there, the different videos that we have created over a period of time. And the truth is, the information that I have gleaned over close to 20 years of studying and treating and evaluating peripheral neuropathy. This is all information that you'd be paying for each time you talked with me if you came into the office. So the $1,000 price is probably relatively low for what the true value is if you had to do it. So the third pillar, the third step, is getting control of the nerve damage, the peripheral nerve damage. This is a lot more complex process because you need to understand what are the different disease processes, what are the different things that could be causing the damage. So we have 12 videos that talk about the different neuropathy types and the different kinds of damage that can be happening, including a process and discussion to help you diagnose your neuropathy type. So we're not just throwing videos at you and saying, okay, good luck. We're actually giving you the processes and the steps that you can go through to say, okay, if I do this and this and this, I will know if I have compression neuropathy. If I do this and this, I will know if I have small fiber neuropathy, large fiber neuropathy, whatever. And it gives you the ability to truly understand what's going on. And then we teach you a master class on how to evaluate your neuropathy type. So now once we give you the information, then we say, okay, how do I evaluate it for me? How do I evaluate my particular process? So you can actually go through and really understand what's going on. We give you some specialized master classes on orthomolecular neuropathy. So I talked a little bit about this in this master class, but orthomolecular is truly understanding the vitamins that are going to help your neuropathy and what levels they should be at, and when they should be above RDA levels, when they should be in RDA levels, or when they're going to affect the nerves, whether it is a deficiency problem, a dependency problem, or whatever. And the diabetic neuropathy, the most common, like we said, type of peripheral neuropathy is diabetic peripheral neuropathy. So we teach a full master class. I teach a full master class on diabetic neuropathy, what to do to manage your diabetes, how to look at whether the neuropathy is part of the problem, and what types of problems you can avoid by managing the diabetic neuropathy in this particular master class. Genetic neuropathy. A lot of times people are, even if they are given some options to try to diagnose what the causes are just told, oh, you have a genetic neuropathy. So I teach a master class on genetic neuropathy to help you understand what that means, how you evaluate it, and what options there are to treat it. But there's some disease processes that I have found to be directly related to or correlated with peripheral neuropathy. And my theory is that some of these are related directly to peripheral neuropathy, restless leg syndrome being one. I feel that it's a nerve malfunction that's causing the restless leg syndrome, and if you can treat peripheral neuropathy, your restless leg syndrome improves. How about a discussion of fibromyalgia? One of the most debilitating problems people are running into nowadays is a diagnosis of fibromyalgia, which they've got studies showing that it's a small fiber neuropathy, that it's directly related to small fiber neuropathy. So if you could treat small fiber neuropathy, you can improve your symptoms and control your symptoms of fibromyalgia. What about some very complex nerve dysfunction like the complex renal pain syndrome or reflex sympathetic dystrophy? What if you could control those through treating your peripheral neuropathy? Now, because this is such a complex process, because it's using my years of experience, my years of knowledge, this is a nearly $2,500 value that we're giving to you over that 30-day period. The information we're giving you, the master classes we're giving you, the discussions that we're giving you are significant in helping you find a way to diagnose and treat your peripheral neuropathy, even in your home. Because we're going to give you the tools. You say, okay, I'm going to go to my doctor, I need to do this test. I'm going to go to my doctor, I want them to evaluate this, this, and this, and give me the answers so that I can decide what else I need to do for my peripheral neuropathy. Okay, at this point, how much would this be worth if all we did was give you the tools to understand your peripheral neuropathy, to control the damage that you're causing, and to really do some additional work in managing the symptoms of your peripheral neuropathy? How much would that be worth to you to just have that three-legged stool that's relatively stable and working? But we're giving you 30 more days because we want to give you the lifetime tools for peripheral neuropathy, the lifetime tools that are going to give you full control of long-term peripheral neuropathy management. So part of this is multiple master classes that are going to take you through the process in different ways, in looking at it in multiple different ways so that you can find what works perfectly for your goals, what you're trying to do. One of the master classes, How to Live an Extraordinary Life with Neuropathy. We give you a 7-day instruction on the power of meditation in neuropathy and actually take you through that process. We give you a master class on nutrition and peripheral neuropathy so you can say, okay, how can I modify the way I'm eating, the nutrition I'm bringing into my body to help get better control of my peripheral neuropathy. We give you instruction on how to involve other physicians in your neuropathy care so that you can actually say, okay, I'm not going to Utah. I don't live in Utah. I live in California, or I live in England, or wherever. You say, I want to get this information. What do I need to do with my doctor to better manage my peripheral neuropathy? And we give you that instruction, that information. 60 Minutes to Living a Neuropathy-Free Life is a master class that actually is taking you through a process that would only take you 60 minutes a day to completely control and manage your neuropathy so that it doesn't interfere with your life. Or a master class on how to enjoy your life even though you have peripheral neuropathy. Or the daily routines to live happy with neuropathy. What if there were simple steps, simple things that you could do every day? We do that. We teach you that in the master class. Then we give you a checklist. So you can actually say, okay, what do I need to look at each day to make sure that I'm doing what is necessary for my life to thrive in my extraordinary life with peripheral neuropathy. And then we end the process with the Neuropathy Lifestyle Masterclass. This masterclass is designed to pull everything together and say, okay, now that I understand my peripheral neuropathy, now that I'm managing the symptoms of my peripheral neuropathy, now that I'm controlling the nerve damage and trying to thrive, what does that mean for the rest of my life? In this too, we are throwing a large amount of information at you. We are using years and years of experience. We're doing a deep dive into some of the studies, and some of the information is likewise a $2,500 value that we are giving to you as part of this program. So what does that mean? So I've thrown a whole slew of information at you, and you're going, okay, this is way too much. I don't understand what that means. What does that mean? Well, there's more. Before I even go into what all that means, we've got additional information. We've got an integrated meditation program that can be utilized as part of the 7-day meditation training that we give you. So you have a program that you can actually use. You don't have to go find one. You don't have to go find the information to be able to do meditation at home. We give it to you as part of this program at $297 value. We give you a lifetime membership in a private neuropathy group, so you can actually ask your questions. You can get support and information and answers from others likewise suffering, but also me or my staff are in that group on a daily basis to help you get that information as well. This is a $300 value, and it's lifetime. It's lifetime membership, so you don't lose that. And then as bonuses for individuals that are participating at this point, that are joining the program at this stage, we're giving it 12 weekly calls with Dr. Gibson, with myself, to discuss neuropathy questions. So we will actually have a call and a call-in number and information that you will receive, so you can actually get on the phone and say, I have a question, what's going on? But you can also hear other people's questions and get some of the answers you need from that. This is a process that will happen every week during your 90-day boot camp journey. This is a $1,600 value. If you were coming into my office 12 times, it would cost you more than the $1,600 to actually be able to sit down with me for 30 minutes or an hour and actually get your questions answered. But even more, an even more valuable bonus. Instead of being on a call with all the other individuals that are in the 90-day program, we also give you a 30-minute call. We usually recommend that you do it near the end of the program, but this 30-minute call will allow you to create your long-term neuropathy plan. We can actually create a process, say, okay, let's get control of your neuropathy and give you a plan that you can live with for the rest of your life. This is a $450 value. It would cost you about, what, $1,500 to $2,000 if you were doing it through my office, because we'd have to go through the process of getting all these diagnosis things in place first, and then you would sit down with me for the $450 to try to get a long-term neuropathy plan. So here's everything that we're giving you as part of this program, which is a $7,588 value. But if we add the bonuses, that's another $2,000 value, which brings the value to $9,638, or close to $10,000. So $10,000, but there's no way that we're going to charge you that much money. We give you a 95% discount and bring the price down to $497. My question for you, would this be worth the $9,000 if we could get control of your peripheral neuropathy? How about $500? Is it worth $497 to get control of your peripheral neuropathy and to be able to manage it for the rest of your life and live an extraordinary life without problems? $497. But I want to make it even easier for you. For a limited time, we're taking $200 off that, because I need people to get this information. I need individuals to have the opportunity to get control of their peripheral neuropathy. This is very, very important to me. So I've reduced the price from $497 to $297. I can't keep it at that price forever. The information, all the time that has gone into creating this process is worth significantly more than that. So only for a short period of time will I be able to keep it at such a low rate. But I invite you to participate. I invite you to take control of your peripheral neuropathy. I invite you to commit to less than $300 to join the 90-day boot camp. If you'd like to join this program, if you'd like to be part of this, then go to www.drbrantgibson.com/bootcamp, and you will have the opportunity to sign up and start participating. I hope this has been valuable to you. I hope we've given you the opportunity. And I would love if there are any questions or any comments that people may have that we could actually address here at the end of this masterclass. Are there any questions, any concerns, anything that people would like to talk about? One of the questions is if you live in Utah, can you do this program instead of coming into the office? You can, and it's a good option. It's a good way to actually get control of your peripheral neuropathy. But there are things that we do in the office that will be easier if you come to us based on what you're going to need to do in that 90 days. So you could do a combination. You could say, I'm going to do the 90 days so I have all the information, but I'm going to come do some of the tests that need to be done in the office. And we would direct your process a little bit more carefully based on the information that we're sharing and the information that you're learning in the 90-day journey. Other question is that individuals are asking whether it's possible for somebody outside of Utah, like we've talked about, to be able to come here and get treatment if that was their desire. And that's absolutely true. We'd have to work with you and help you get the information. The disadvantage of that is it's a period of time. It will take you some time of being here or coming back and forth to go through this whole process. I'm not discouraging that, because you will get better information being able to do the exact tests that we need to do and having them done by me so that we know that we're getting them exactly what we're looking for. But some of this can be done in pieces. So we could say, can you tell me what labs I need to take? And you can do those there. And then you come in for a period, say, okay, I'm coming in for the certain tests that have to be done in an office so that we could actually do them for you here while you were here for a couple days or whatever. So there's definitely ways you can do it if that were part of it. So thank you, everyone. I'm excited to start this process with you. I'm excited to start this journey with you, and I want to give you back your life. I know for a fact that if you really, really want to get control of your peripheral neuropathy, it's going to take you getting the information that you need and you taking control of your life through that process. So, isn't it time that you get back control of your life?